Most of us know what a standard tension headache feels like. It's that dull, squeezing pressure wrapping around your forehead like a tight rubber band. Then there are migraines. If you get them, you know the familiar throbbing pain, the intense sensitivity to light, and that overwhelming urge to lie perfectly still in a dark, quiet room. But imagine a pain so intense, it actually wakes you from a deep sleep. The agony is so sharp that it physically forces you out of bed to pace the floor in the middle of the night. This is a cluster headache. It is a rare neurological disorder, and medical professionals routinely classify it as one of the most painful conditions a human being can endure. Casually grouping this condition with everyday headaches often hides its severity. This can lead to years of misdiagnosis and silent suffering for those caught in the cycle. When an attack hits, the nervous system enters a state of extreme agitation. Sufferers will pace the halls, rock back and forth, or become frantic because the pain is too severe to allow them to sit still. This condition has a very specific footprint. It primarily affects adult men, typically showing up for the first time when a person is between the ages of 20 and 40. It is also quite rare. Only about 0.1% of the general population, or roughly 1 in 1,000 people, will ever experience it. This combination of frantic pacing and extreme rarity points to a physical emergency in the nervous system that very few people truly understand. Cluster headaches have a specific pattern. Pain is strictly one-sided, anchored directly behind one eye. Along with pain, the eye tears up and turns red, and the nostril becomes congested. Observers may also notice a drooping eyelid and a shrinking pupil on the affected side. This diagram shows the pathways behind these attacks. Note the connections between the hypothalamus and the trigeminal nerve. When these areas of the brain misfire, they trigger the intense pain and the physical facial symptoms at the same time. Because these involuntary physical signs are so visible, a doctor's observation is just as important as the patient's description of pain for a correct diagnosis. The timing of these attacks is incredibly rigid. The pain peaks in just minutes, lasting anywhere from 15 minutes to 3 hours, and can strike up to 8 separate times in a single day. These attacks group into cluster periods, lasting weeks or months, often hitting at the exact same hour every night. Then they suddenly vanish. This remission grants months of pain-free life before the cycle restarts without warning. Inside an active cluster period, the body becomes highly sensitive. Consuming a small amount of alcohol, smelling strong paint fumes, or using tobacco causes immediate attacks. This predictable timing and high sensitivity to triggers show that cluster headaches are part of a systemic biological cycle. Because the pain peaks so quickly, standard over-the-counter painkillers like ibuprofen are ineffective. By the time a pill is absorbed, the attack has already reached its most intense point. Instead, the primary treatment to stop an active attack is inhaling 100% pure oxygen at a high flow rate for 15 minutes. There are also specific prescription medications called triptans. These must be taken as a nasal spray or a quick injection to get into the system fast enough to work. To stop attacks before they start, doctors use preventative treatments. Medications like verapamil or short courses of steroids are used specifically to break the cluster cycle and prevent future episodes. Securing relief requires moving away from standard pain management and shifting toward targeted neurological treatments. If you experience red flag symptoms, like a sudden onset severe headache or a new pattern of pain after age 50, you should seek medical attention immediately. To rule out other causes, like a structural lesion or an aneurysm, a doctor will likely order an MRI of the brain with contrast. When speaking with a doctor, remember these 3 main signs: strictly one-sided eye pain, the inability to sit still, and signs like a tearing eye. Do not rely on standard painkillers if they aren't working. Seek out a healthcare provider or a neurologist who specifically understands these types of neurological conditions. While a cluster headache is terrifying and isolating, securing the correct medical diagnosis provides the map needed to return to a normal, pain-free life.